Mental health apps have exploded in popularity because they offer something people desperately want: help that is instant, private, always available, and easy to use. They can guide someone through a breathing exercise at 2 a.m., provide a quick journal prompt during a stressful workday, or send gentle reminders encouraging users to stick with a self-care routine. These features genuinely matter. Even simple tools like mood logs, gratitude lists, or daily check-ins can create structure for someone who feels overwhelmed. Many people struggle to notice patterns in their emotional lives, and an app that visualizes mood changes over weeks or months can make invisible trends clearer, showing how sleep, stress, diet, or social interactions influence how they feel. For users dealing with mild anxiety or stress, having a digital space to externalize worries can be grounding. And because the apps do not judge or get tired, they often feel like a low-pressure entry point into thinking about mental health more openly. Some apps go further by offering elements inspired by cognitive behavioral therapy. These might include exercises that challenge unhelpful thoughts, teach problem-solving techniques, or provide brief educational explanations about how emotions work. While these tools cannot replicate the depth of real CBT, they can introduce concepts that help users understand their thought patterns better. For someone who has never spoken with a therapist, the structured design of an app can make emotional work feel more approachable. This can be especially helpful for people in areas with limited access to mental health services, or for those who feel uncomfortable seeking help in person. In that sense, mental health apps can act as an empowering first step, something that lowers the barrier to taking mental well-being seriously. However, the same simplicity that makes these apps appealing also marks their limits. Mental health is deeply complex, involving biological factors, interpersonal dynamics, life history, trauma, medical interactions, and socioeconomic stressors. An app cannot interpret how all these pieces fit together. It can log a user's mood, but it cannot ask follow-up questions about sudden changes, notice subtle warning signs, or understand when a user's situation is deteriorating. A mood tracking graph might show someone that they are feeling worse, but it cannot evaluate whether their symptoms meet the threshold for clinical depression or whether the person is experiencing risk factors that need urgent intervention. This is why relying solely on digital prompts can create false confidence. The user may feel that they are doing something for their mental health simply by completing app exercises, even if their emotional stability is slipping in ways that require professional assessment. Another major limitation is that mental health apps cannot provide nuance. Real therapy adapts continuously. When a patient becomes anxious, the therapist responds. When someone avoids a difficult topic, the therapist notices and gently redirects. When a person shows signs of trauma, the therapist modifies the approach to avoid re-traumatization. Apps cannot perform this kind of fine-tuned emotional calibration. Their prompts are generic, based on algorithms that do not understand context. Someone dealing with panic attacks, grief, or intrusive thoughts may find that app exercises feel superficial or even invalidating. In the worst cases, users in crisis may turn to an app expecting clarity or comfort, only to encounter automated messages that are unable to meet the severity of their needs. This gap can be dangerous because people may mistake a calm interface for actual care, delaying the process of seeking real help. Privacy and data use also raise concerns. Many mental health apps collect deeply personal information: daily emotions, habits, behaviors, and even sleep and movement patterns. Not all apps protect this data equally, and some share information with third parties for advertising or analytics. While the apps can be supportive tools, users may be unaware that their most sensitive feelings could be used commercially. This creates another layer of vulnerability that a therapist's confidential environment would not expose them to. There is also the risk of self-misdiagnosis. By reading app-generated trends or completing symptom questionnaires without professional interpretation, people might assume they have conditions they do not actually have, or conversely, dismiss symptoms that deserve medical attention. Someone dealing with bipolar disorder, ADHD, PTSD, or severe depression needs careful evaluation that apps cannot provide. A digital worksheet that encourages cognitive reframing cannot replace the specialized insight of a clinician trained to recognize the complexities of mood disorders and their interactions with medication, physical health, and trauma. Yet despite these warnings, mental health apps still offer real value when people understand their proper role. They can help users feel more in control of their emotional life. They make self-reflection easier, reminding people to slow down and check in with themselves. They can reinforce healthy behaviors like journaling, breathing exercises, meditation, or gratitude practice, which are beneficial even outside clinical contexts. For individuals who are already seeing a therapist, apps can become a useful extension of therapy, allowing them to practice techniques between sessions, track progress more systematically, and bring concrete examples back to their clinician. The most positive impact emerges when apps are treated not as replacements for professional help but as tools that fill the space between sessions, moments of stress, or long periods when someone is working on building new habits. They can increase awareness, strengthen emotional vocabulary, and help people respond to difficult feelings with slightly more structure. They can reduce stigma by making mental health habits feel as normal as tracking steps or budgeting money. And they can encourage people who might otherwise avoid therapy to eventually seek it once they see that emotional work is manageable. The real challenge is ensuring that users understand both the benefits and the limits. Apps can support, but not diagnose. They can guide, but not deeply understand. They can calm, but not treat underlying disorders. When people recognize these boundaries, mental health apps become genuinely helpful companions, providing gentle structure, emotional reminders, and practical tools, without creating the dangerous illusion that digital self-help is enough for every situation.